Thank you, Courtney. I really appreciate your help since this is our first virtual lunch with Zoom with a bigger crowd than just our interns. I want to kick off this session before Dr. Frank and I have a lively discussion I know everybody will be intrigued by. I want to recognize a few points that I think you guys would all want to know. Today would have been the first day of our 16th annual Asbestos Awareness Conference. People like Toby and others were already registered. But I have to tell you, more importantly, we had sponsors that were supporting our work, speakers and honorees that were raring to go. And as much time and work as we put into planning the conference, we had to unwind it, as you all know, about 3 weeks ago. It doesn't take us off the grid. We're going to keep going, and we have a great forward plan. But I just want you guys to recognize today would have been the day we were walking over to the Senate buildings to share our stories, to talk about the Asbestos Awareness Bill, the Alan Reinstein Banned Asbestos Now Act, and we had great activities. So I guess it's stay tuned for more. ADAO has been around for 15 years. For those of you who don't know our work, we have Ellen is on this Zoom call. She's a board member. People like Dr. Arthur Frank and others donate their time, and we run a very lean and mean NGO out of my home office, which is where I am now, with people like Nicole and Rebecca who help do our work. Our work does require some dollars, although we're very financially sound. The sponsors that do donate to our work never ask me for anything. In fact, they don't get a legal referral or anything else. They do it because they know it's the right thing to do. We are the largest organization working on prevention and policy in the United States, and we help countries around the world. There are over 7 countries represented in this call today. I think that shows the reach that ADAO has both nationally and internationally. So since we can't toast to our sponsors, I'd like to take a second and just I'll call out your firm's name. You can do like a little wave, because I did ask if some people wanted to speak and then it got a little complicated. So I'd really like to thank Simmons Hanley Conroy for being our generous platinum sponsor. We have Gary and Sarah there, and I don't know if Perry's online, but we thank you for generously being our platinum sponsor and helping us to do our work. And then we have our gold sponsor, Motley Rice, and Motley Rice along with Simmons have been walking this path with us for over 10 years. I know Anne is there, and Anne, if you want to say a quick hello, you can. You're unmuted.
Hello.
So because of Motley Rice, also as a gold sponsor with Aaron and others, we have really been able to leverage our voice in DC and around the nation and world. So thank you to our our platinum sponsors, Simmons Hanley Conroy, as well as Motley Rice. So with great gratitude. I want to start off, this is going to be an informal conversation, and lucky us to have Arthur Frank. Arthur, could you share a little bit about the how and the why, when we met, and why you've been helping ADAO for 15 years?
I still can't hear. I don't know what I'm doing wrong.
So, as many of you know, and for those of you that don't know me, I started doing asbestos work in December of 1968 when I started as a medical student at Mount Sinai with Dr. Selikoff.
I'm sorry, I don't know.
I'm going to have to unmute Amy. Sarah, maybe you can help her. Okay. I'm sorry, Arthur, go ahead.
Yeah, so I've been involved with asbestos and asbestos work for many years. And in 2004, there was a conference, Sugio and his organization sponsored in Tokyo, to which I went, had some of my Chinese colleagues come join me there. It was a place that I was working on asbestos with them, and met Linda. We met over some sushi one evening, and Linda shared with me her interest and concerns about asbestos. Alan, her husband, was still alive at the time. She shared with me that he had developed, with relatively little exposure, a mesothelioma and was being treated for it. We got talking, and I committed to assisting her at ADAO at that point, and said that I would be there for the long haul. And here we are, I guess, 16 years later, and I'm still active. Linda has asked myself and Dick Lemon, who was a former deputy director at NIOSH and has had as many years as I have in working in the area of asbestos, serve as co-chair of the Scientific Advisory Board. And I think with one or two exceptions, I have been at every one of the annual meetings that's been held each April. We even sponsored, I think it was the third one here in Philadelphia at the time. So I go back a long while with ADAO, and as I sit here today in 2020, still am doing asbestos work. Had my most recent paper published this past Sunday. Have two more papers under consideration, and have worked in many places around the world. And I see my friend Guillermo from Bogota is on with us, and have recently published some of the first definitive work on asbestos disease in individuals in that country. So that's my connection with ADAO, and a life spent looking at asbestos and asbestos-related issues.
Well, Arthur, you have a family that absolutely loves and respects you. So it was just 48 hours ago, I did a, "Hey, Arthur, could you help me out?" And he's like, "Sure, Linda." And we weren't really sure how we were going to put this together, but we thought our community, as one of our sponsors, asked, "How's the community doing?" And based on a lunch that I did with my interns, I mean, we're all suffering from COVID-19, whether we have someone that's diagnosed or hopefully no one that's being treated, but you know, it's impacted all of our lives. So we thought we'd use this time just to connect and share. And Arthur we went through some touch points. So I'm going to ask Arthur some questions. I believe, Courtney, if anybody joined after Courtney gave the spiel, you can put your question in the chat box on the far right. If we have time, we'll come back to that. So Arthur, what I'd really love for you to do is tell us a little bit about COVID-19 from a physician's perspective. What is it? Where is it? And kind of what do we do?
Sure. We live in a world that is full of viruses. A virus is not an organism that can survive outside a living body. It invades cells. It takes over the reproductive mechanism in those cells, but instead of the cells doing what they normally do, the cells are taken over by the virus to produce more virus. They have to live, they can live outside a body, but for varying periods of time. Perhaps we'll end up discussing that. But COVID-19 is one of a family of viruses called coronaviruses. They are fairly common. They usually cause pretty much the common cold, along with some other virus families that do that, rhinoviruses and others. The reservoir for this was felt to be in animals. Animals are reservoirs for many viruses, and specifically coronaviruses. There was some interesting material the other day that this virus, or something very, very similar to it, has probably been around in animals 1,000 miles from Wuhan in China for a number of years already. And at some point, this virus, which lived in animals, some people think bats, some think otherwise, it has now ended up being transferred to humans. And because of our modern world with intercontinental travel being as easy and simple as it has become, it has literally now spread all over the world to more than 180 jurisdictions that I'm aware of.
So knowing that, Arthur, we have a community, we call ourselves mesothelioma warriors, not that that's the only signature disease that is caused from asbestos exposure, but we have those that are compromised because of treatments or possibly lack of a lung and other things. So we not only have our warrior community impacted by COVID-19, but we also have professionals like many of you that are still working, whether it's in your home. So although most people know the very common WHO recommendations, I think there's some new recommendations that came from Los Angeles last night. So I thought you might want to touch on, what do you want to recommend medically for safety, Arthur?
Sure. So this is a virus that the world, at least its human population, has not seen. There's no built-in immunity. It is so new that there's so many things we don't know about this virus. We don't know, for example, if there's any cross immunity in people who had other coronaviruses to which they've been exposed in the past. And the modes of transmission appear to be really three ways. It's by droplets. The virus is in droplets that people sneeze or cough out, and they can stay in the air for a number of hours. It can end up on surfaces, and so if they end up on surfaces, they can live there. Again, we're starting to learn about that for varying periods of time, but literally up to days in some cases. And so if someone touches that surface and then hasn't washed, it ends up being transmitted into their body through possibly contact with tears in the eyes, the nose, the mouth. And then anybody who's around caring for someone in what we call close contact has a very good chance of picking it up. The advice is still, unfortunately, really very simple. There's not that much in a sense that's new. You wash, you use disinfectant. If you, like I haven't been able to find any normal disinfectant in the store for a number of weeks. You can take household bleach that you've got, dilute it down about 1 part in 10, put that in a spray bottle, and you've got yourself a disinfectant that works. For a couple of reasons, I have stayed sequestered now for, yesterday I think was 3 full weeks. I've been out a couple of times for grocery shopping. I go during senior hours, so I take advantage of that. I take wipes with me with the bleach solution I've made up, wipe down the cart. I've started wearing a mask out in public. I think that's an important new addition. Again, not to take away surgical masks or N95 respirators from others, but just to go out in public wearing some kind of cloth mask, even a bandana, something, a scarf. You know, if you happen to have a mask, that's important. In my house, I have to take special care too. I've got a wife. We're both of an age that alone puts us at risk, but she's had severe asthma for many years. And what we've learned is that the people most at risk for ending up on respirators and actually succumbing to the disease are those that are compromised in a number of ways. But the 2 leading causes are having underlying diabetes or having some kind of respiratory problem like asthma. As Linda points out, it's not only mesothelioma warriors, but anybody with lung cancer that's under treatment, even underlying asbestos disease that's not malignant, asbestosis, puts people at risk. A colleague just shared with me earlier today a paper from Korea that looks from several years ago that people with pneumoconiosis, and asbestos or asbestosis is one of the pneumoconioses or dust diseases of the lung, that those individuals, should they get pneumonia, and the coronavirus causes a viral pneumonia, that's really what's occurring, have a much worse outcome than people without that. So all the usual things that we've been hearing about are relevant here, and my concern has been, as the ADAO website material documented, that I had concern for people with underlying asbestos disease, but that would apply to anybody with lung disease, be it pneumoconiosis of other kinds, coal, silica, whatever.
Yeah, so I mean, I think we can, none of us can be too safe. We're going to put some resources on top of the landing page for this website for this event later on. We usually link to the CDC or WHO, but I've also seen some secondary pamphlets, etc., like from AFL-CIO. And we in the Reinstein home, when we get boxes and things, we are keeping them out in the garage and we're spraying them down because what Dr. Frank is saying is that we don't know how long the virus can actually live on metal, on paper and elsewhere. So you can't be too careful. Dr. Frank, there's a situation that I'm being asked about by some warriors is their treatment plans have actually been halted. For those of you who don't know me personally, I had an injury. I fell at the beginning of March, and it resulted in a trip to the hospital by ambulance and emergency surgery to repair my arm. But, gave me a new heightened sense of how hard healthcare workers, the 12-hour days, and how they're exposed from the ER to the surgery to the OR. But I think for treatment, for anybody who is undergoing treatment, it is terrifying right now because they don't want to go to the hospital. And many hospitals are just obviously postponing elective surgery, but even some chemotherapy. So that's a problem, Dr. Frank, that I'm hearing from our community.
It's a very real problem. My older son is actually an oncologist. He's out in California at Stanford. He's been put in charge of screening individuals that are due to come in for treatment as outpatients. He works both with outpatients, and he's been trained and does work with bone marrow transplant, again, people that are severely immunocompromised. And clinicians are using their judgment. He shared with me that there was a patient the other day that he felt needed to be in the hospital for treatment of their underlying disease, but the hospital made him go through so much activity and proof that he thought it was the disease, not the COVID situation that was causing the patient's temperature. It took 3 hours to get the patient in the hospital. That said, if someone, in my judgment, but again, this would depend on each individual case and what the treatment is and what the treaters say, but I would think that if people who are undergoing treatment are taking the proper precautions to keep the social distancing, to do what Linda says in terms of, as we're doing in our household, we don't leave boxes outside, but we wash the surface of everything, including the Daily Mail now, down with our bleach material before we handle them, that people's treatment as much as possible should continue to treat their disease. But again, this would be an individual judgment for each treater. But if people have been sequestering themselves, have got no evidence of disease, the problem being, of course, you can still be infectious without treatment or without any symptoms, rather. And if you've been around people that seem well but could have exposed you, I think there's some careful screening that needs to be done. But ideally, people should continue with their therapies as they need them.
Yeah, great recommendations. I'm encouraging patients and caregivers to keep journals so that because I don't know about how you guys feel, sometimes every day to me feels like Monday morning or it feels like Friday night, because we really are living in this world of no calendars and no demarcation between day and night with our work and our home lives being isolated. So I'm encouraging keeping journaling and making sure you have all of your medicine stocked up so that if you have a prescription that you think, you're getting down to the last week of that prescription, to make sure that you're contacting your physician so that you have your medicine, all of things to keep you healthy and to continue your treatment as your doctor has prescribed. Dr. Frank, I don't know how we want to handle this one, but this is a common question I'm getting. Is in our very new normal, which none of us really want to embrace and say thank you to, managing our health and wellness on a daily basis is really tricky. So as a physician, what do you want to recommend to the folks on this call?
Well, it's not just, of course, the physical issues that we've already discussed, but there are other aspects of one's life that are very much impacted. I have the fortunate situation of sharing my home and living space with my wife, but we have a couple of our kids that are literally isolated. One hasn't gone out, essentially for 3 weeks and feels very much cramped in his apartment. So there's the feeling of isolation. That said, while we may have physical distance, but there is a phrase that came up of social bonding. And one of the things that I've been doing and what people have been doing with me has been keeping in touch. This is a time, and we never have enough time under normal circumstances to be in touch with our friends, colleagues, family. And this is a good time to reconnect. I've been very fortunate. I've both written to people literally all over the world, you know, South America, Asia, Europe, people that I've worked with over the years and gotten to know. And very gratifyingly, other people have written me, how am I doing? So this is a time, since, you know, you're all online with us, you've got a computer, spend a few minutes socially bonding, even if you can't be there in person with people. There are certainly mental health issues here. People are losing their jobs. We have the holidays that are coming up. Easter, Passover, Ramadan's not that far away, so folks are unable to carry out normal family events. Things like virtual dinners with colleagues and family. You know, people have been having social hours, 5, 6 friends getting online. All of those things are important. The other thing implied by Linda's question is one needs to keep up with one's wellness. Your diet needs to be maintained. Don't sort of let your diet go to pot because, or what you're eating change that much, because it's not going to be healthy in the long run. I've been the cook at home for decades and decades now. I happen to like cooking with fresh vegetables and lots of fruits. So that's the thing that drives me out to the grocery store more than anything else. I certainly can live off, you know, rice and pasta and stuff I have in the freezer. But I want to be sure that we still eat healthfully. People also suggest you try to get some exercise, if it means being able to go out and take that walk with the social distancing, or even doing some exercises at home. And another recommendation, and I've done a bit of this, is making use of music online, art online. We just had on our new news here today, a wonderful sharing with the population of the Philadelphia area, that there's an organization that has tours of many outdoor art exhibits, statuary around the city, murals around the city, and many, many museums, not only in this country, but around the world. You can go visit things that you normally wouldn't have time for. If you've never been to the Uffizi Gallery in Florence, you can get online and look through their art collection that way. So those are things that you can do to keep up your mental wellness, your physical wellness. So it's diet, you know, getting something into your life that takes you out of the minute by minute concerns that many of us might have about the effects of the virus on ourselves, our country, and the world.
I love the idea of grabbing some red wine and going to do a tour of the Uffizi. I might have to pinch that idea, Dr. Frank, and then send you a picture.
That's why I'm sharing it.
I like that. There's also a topic, and it's always in the US, it's always very hard to talk about, but we talk about emotional support. I've had a couple people message me, and one family is now in hospice. And it is isolation can have a huge impact on your emotional well-being. And I would be irresponsible if I didn't encourage any and everyone who has just a glimmering of that darkness to reach out. And I know Dr. Frank as a physician can give you better recs, but I think it's okay to own that we're all going through something that is so new, and it's not normal, and it is scary, but we're not doing it alone. And I think touching on suicide support, Arthur, as hard as those words are to put together, I think we have to, for people who might join this webinar later on, to touch on what do you do if you're feeling those really dark, narrow tunnels? Where do you go for help?
Well, there's certainly online organizations. I think what you do is you turn to family and friends. And that's what I mean about, you know, the social bonding. Be in touch with people. Unfortunately, just heard about a situation not surprisingly today, there are a number of states that are claiming, and again, I don't want to get into anybody's politics or religious views, but there are women that are trying to get care for abortions, for whatever, and these times they may feel this is not the best time to bring a new child into the world, whatever, and that women in those situations in states where they haven't been able because of the virus, because some states are saying abortion care is not essential medical care, that suicide has become a discussion point in that situation. Human beings are indeed pretty resilient, but we need not go this alone. You know, the common phrase we hear is, you know, we're all in this together. Again, I don't want to get into politics. You know, there's different ways and different views of what all together means, but I think this is a time to connect with family, with friends, with loved ones, and with the professional groups that are out there that assist with severe emotional disturbances. We ought not to forget that there are other aspects of this that we might not otherwise think about. It's been reported, for example, that child abuse calls are way down, and nobody thinks that child abuse has stopped occurring. It's just that this is not a time where people are making that connection, and in fact, the expectation would be that it would be greater now under the stresses and strains of losing jobs or being isolated at home and so forth, and that a lot goes on behind the scenes that we don't know about. And social workers can't visit homes anymore, and they're, you know, calling in or computerized visits don't really get to where it needs to be. So this is an important aspect too, and I think we need to make use of all the resources that are out there, both personal and professional, to deal with issues like that.
Yeah, thank you for your honesty, Dr. Frank. I'm going to go to some questions that Nicole is putting over in a document that's a little bit bigger for me to read. When you're 64, it gets tricky. One from Rich. Question reads, has the CDC projections been too optimistic in not showing the second and third waves of pandemics, even assuming that the first curve is flattened?
Well, I have no better information than the CDC or any place else. I do think the basic point is absolutely correct. We're seeing inklings of that in places where the curve was very much flattened. Hong Kong, a bit in Japan, where they dealt with this very strictly, very early on. It started easing up, and there seems to be a resurgence. Again, we don't know enough about this virus. It may, like other coronaviruses, stop being as active as the weather warms up and as the seasons change, but it's entirely reasonable to think that there will be a resurgence. The other problem that worries me even more is not so much a resurgence, but this whole initial episode, at least here in this country, has been dragged out because while we're starting to see perhaps some flattening of curves in places that dealt with this very well early on, Washington, California, even to an extent, the hard situation in New York, in places where people are still out and about and going to movies and restaurants and, you know, lollygagging on the beaches and so forth. And just as another example, from a clinician's point of view, the folks, those two boats that just landed in Florida yesterday that were literally out at sea for an extra week or two, the fact that people who were supposedly asymptomatic, and we know you can pass on the virus while being asymptomatic, and the varying figures I've seen is that up to 25 to 50% of people who test positive in some settings may have had the disease, could have passed it on, but never had symptoms, that we are acting in a way in this country that is going to stretch out the length of time that we're going to see peaks and valleys as this spreads around the country and literally around the world. So I fear a little bit that nobody really knows what's going to happen. And there may be another question, but I'll throw this out as in terms of my thought. There's so much bad information out there. I think the most honest thing people can say is we're still very much on the learning curve. There's so many things about this virus and its behavior that we need to learn, that one should only use credible sources. The World Health Organization, while again limited, is credible. The CDC in most ways is credible, but they are, I hate to say this, being played politically like so much of the other aspect of this outbreak in this country. So things go back and forth that are sometimes politically motivated rather than scientifically motivated. I worry for Dr. Fauci and his safety and health and well-being, because he sort of says it like it is, and he's a source that I would trust. If you want good data, it's astonishing that the CDC is not the source of the best data in this country. It's the Johns Hopkins website on the coronavirus is the one that I would be trusting to collect data. We certainly can honestly feel that the data collected from around the world is not entirely accurate. Countries have reasons for not reporting. And we have all the social disruptions that go along with this. And in a sense, we're going to come out of this at some point on the other side with a markedly increased death rate around the world and in this country. Not all of it will be directly related to the virus, but to secondary effects. You've got 1 billion people in India, 1.3 billion that we're told to stay in place, yet a daily worker who eats literally from day to day is asked to stay in place but has no access to food, which he was buying on a day-to-day basis from daily earnings. So we're going to see mortality that's virus related but not virus caused. So I think any figures that we have are going to be best guesses by good people, and I really do have a concern that the future, while unknown, and how long this will last is unknown, but I fear it's going to be longer rather than shorter.
Yeah, scary, but very honest. And again, we're going to put links to Johns Hopkins and other sources for good information on this website. As you know, I have 1.5 hands, so we'll get to it hopefully later today. Without disclosing this person's name, I know a person who suffers from type 1 diabetes, and it's very scary when you have an immune deficiency. And the question from this person is, once you've contracted and been sick from COVID-19, can you get sick from it again?
Unknown. One would hope that antibodies that are produced will be protective in the future. The problem is we get colds, over and over. Now, it's not always to the same virus. As I said earlier, there are multiple viruses that cause the usual summer colds or winter colds. We also have the flu that does change. There's a few things about this virus, at least at the moment, that give us a little bit of hope, and more positive than negative. It doesn't seem to be mutating particularly quickly, which means if we do come up with a vaccine for the virus as we find it now, hopefully it'll continue to work at some point. I'm also just encouraged by the medical and scientific world rising up to this challenge in so many ways, be it looking for vaccines, looking for more active and accurate testing. The last couple of days, I've been reading about a saliva test. The fact that we don't have enough equipment, such as a simple thing like nasal swabs, to do testing is almost unforgivable in a country like ours. But if they do get this sputum test working, it'll obviate the need for that. and then so many people stepping up, if it's, you know, making masks or face shields or 3D printing equipment or building ventilators. The country is doing what one would hope a country like ours would do in any war situation. And this is, in fact, a war, but the enemy is a virus which we can't see, feel, touch, you know, and going out and buying guns is not the answer to get rid of this virus either.
Yeah, good points, Dr. Frank. I want to touch on a couple areas where sometimes people don't have the funds to make a cash donation, but there's time that they can give, or maybe they want to make a cash donation, which we'll put some national organizations that are vetted out. But I want to throw out a couple quick things is while we're all connecting and sharing and embracing our new normal best we can, there are, I see Kathy, I don't know Kathy personally, but Kathy Schnell is up there. She's holding a dog. There's an opportunity to be a foster parent for dogs. So if you have the time, the space, and we know we could be locked down for, you know, 4 to 6 to 8 more weeks, you might want to consider pet therapy, which is pretty wonderful. And ADAO has a thriving community. This is Global Asbestos Awareness Week, and Dr. Frank and I have been working on this for over 15 years. It would have been our 16th week, and all the facts go into the congressional record. I talked to Senator Tester's staffer, and we'd be tone deaf if we were asking, like, are you going to introduce the resolution that we wrote? But Senator Tester has agreed to introduce it after COVID-19 is sorted out. But there's a lot of stuff that ADAO works on, and we would love to have your sharing, your thoughts, build a stronger community. So when we get out of COVID-19, let me tell you, ADAO is going to have a fire on button, and we're going to be ready to go to launch mode. But people like Sandy and Toby and others, and of course, Laura Baker, we know that we have built a thriving community, and it will take a lot to put us down. So while if you are new to ADAO, ping me, message me, tweet at me. There is something for everyone to do while we work on prevention and policy to obviously prevent exposure to eliminate disease. And for people who joined the call early, Ellen, who's on the camera, she's a board member. She was wrongly served a document, and the person came back toting the knee breaker last night looking for me. He served Ellen. So ADAO remains under the spotlight for Johnson & Johnson tout cases, looking for ways that they can mitigate, reduce, eliminate their risk to obviously get out of financial liability. So if you're thinking that COVID-19 is terrible, which it is, redirect some of your worry into something possibly positive, because we would love for you to find a home with some of the volunteer opportunities that we have here there. And I see Vin sitting there, so I'm going to say, hey Vin, just make sure we're like, okay, there you go. Love to see that smile. Coming back to a couple questions. Arthur, you might have already touched on this, but let me go. It was a phone question. Can the virus survive the summer heat? I live in Summerside, Prince Edward Island. Sounds great to me. Is it heat resistant? I think we know the answer, but go ahead and go for it.
Yeah, we don't really know. Other viruses do tend to go away at different times of the year. That's certainly a hope here, but we have not enough information about this virus to know if that will or will not be the case. And the scary thing is, even if it does, just like other viruses that are similar, as long as there will continue to be a reservoir of active cases, which will continue for a long time, and it will continue in other parts of the world. If individuals start traveling again, if borders are reopened and people start moving. China claims, for example, right now that the only cases they're seeing in places like Wuhan are people that are coming in from the outside. We have no way of really knowing or checking that, but even if it's true, it does mean that even after the virus gets tamped down in one area, it can be reintroduced coming from another place. That was relevant to my comments before, that until the whole of the United States, for example, deals with it in a uniform and fairly strict manner with isolation, staying at home, doing all those things. And again, if you're not in a position to contribute financially, As Linda said, there's things you can do for this organization or for other organizations, but the most civic thing that you can do is sort of behave yourself as a good member of our society. Stay home, limit your exposures, limit your potential exposure to others, as tough as that may be. I was talking with the father of my grandkids the other day that we've been talking to them occasionally, but maybe it's time to spend more FaceTime and just visually do it. Again, going back to that social bonding. And if everybody does that, and we've not always had the best of examples coming out of the leadership in this country, distancing, and we've still got governors who think this is a overblown crisis. I won't go into all of that, but you know, from a medical standpoint, this is not so. And the other point, I don't know if Linda, you were going to get to it, but I do want to mention that these are times of moral and ethical issues that we all have to decide for ourselves how we're going to behave. Religious leaders and political leaders ought to do that, but I also worry about the doctors and nurses dealing with patients on a day-to-day basis. You know, when respirators do run out, and you've got two people that need to go on a respirator and only one's available, who do you choose? These are the kinds of decisions one never wants to be in a position to have made. I've been on the ethics committee of a couple of the medical centers that I've worked at during my career, so we've dealt with these kinds of issues. But they are on top of just the bone-breaking work that the doctors and nurses and staffs are doing. These issues rear their ugly heads as well, and it puts people in almost unbelievably difficult situations, but they have to be done. And again, to see people dealing with them, and the ethics committees in hospitals that are having to deal with this. And I'll even make one other suggestion that doesn't cost anything. Those times that you do go out, I was in the grocery store this morning, 6 a.m. when the doors opened. It was fascinating. You know, 3/4 of us old folks that were out there were lined up 6 feet apart. 75% of the people were wearing some kind of respiratory protection over their mouth, be it a mask, a dust mask, a bandana, something. And as I passed one of the staff that was putting out groceries and stuff, I just thanked them and said, you know, thank you for being here and doing this for us. Didn't cost anything but a comment, and I got a big smile for that. And so there's things we can do to make this socially more socially better for all of us, that don't even, you know, make us have to go into our pockets to pay for something.
Yeah, those are all great points. When I was in the hospital on March 3rd for this silly injury that I had that required emergency surgery, had Emily not been there with me, I don't know if I would have made it, because she was able to say, my mom needs morphine and she's got blood dripping down here. And we now know with COVID-19, family members are not able to go in and be with their loved ones. So since we can't be possibly with our loved one in the hospital, I would encourage any of you who know someone who is ill, reach out to the caregiver and the family, send them a card, ask how the caregivers are doing. We can't reach the patient right now, but we could still, as Arthur so beautifully saying, we can connect with our neighbors and our friends and just offer some loving support and some listening along the way. Because I can't imagine being in the hospital, not being able to have my daughter. Thank God I'm home now, but being all alone in the hospital. But for my daughter, that would have been horrific for her not to be able to be with me. So I think looking at caregiving and hospitalization in a holistic way, where we can also touch on the family and the caregivers, could also provide us something positive to do. Arthur, we could eat up this whole hour. I've got a couple questions I'm going to ask you. Laura has asked, how effective are UVA lights in sterilization for COVID-19?
I believe, again, from what I've been reading, I've been trying to follow this, that UVA I don't know about UVA, but UV lights in general are good for getting rid of the COVID virus as it does for others. There's the Tcell Labs out in Ohio, a well-known research institution, has come up with what they think is a way to sterilize and reuse respiratory protective equipment, making use of UV light. So we know that it's been tested and does kill things off. Sunlight, however, is not even though it's got UV in it, it tans our skin, but it's not really strong enough to get rid of the virus. So don't think that being outside, you know, the kids on the beach during spring break were saying, well, I'm out in the sun, that should kill the virus. That's not how it works. But I think UV in proper settings can do that. But most of us don't have UV lights around our house. It would be useful for surfaces and maybe useful to re-sterilize things that aren't negatively affected by the use of that kind of radiation.
Helpful. Bob asked, what about people doing T-cell treatment and need to go to Sloan Kettering, for example? Do you have any suggestions for them?
Well, if you're in the midst of some kind of treatment for disease, this is a time to, before you go, you know, make sure you're isolating and not in any way putting yourself at risk. And then I'm not going to get into the midst of any kind of, you know, treatment decision. As I said earlier, this is where the treaters need to be contacted. You know, if you're getting treatment, can it be put off? Should it not be put off? Should you risk going in and having it? You know, can we be creative and find an alternate way or alternate setting to do it in that doesn't involve travel to a place like New York? There are all these issues, but I think if it's part of a, you know, treatment for caring for people with serious illnesses, again, you have to make some judgment. You know, what's the risk and what's the benefit and what do you do? And that's where each case needs to be handled, I think, by the individual caregiver. But I would not blanketly say, yes, you have to go, or blanketly say, no, you shouldn't put yourself at risk.
Fair. Since we can't all be together tonight to hug and kiss and cheers to a great year that we had, obviously, before all this started, our conference would have been going on today and then tonight and tomorrow. Do you want to touch on a little bit for those people like Toby who thought she was going to get to come for the first time? Want to touch on, like, what does our conference mean to you? I don't want to put you on the spot, or for people who don't know what we do, can you share just a little bit about the conference?
Sure. The conference is important in so many ways. As a scientist, I literally have gone to, you know, dozens, probably hundreds of meetings over the years. But ADAO is special for a number of reasons. First of all, it pulls together individuals that get to interact in a way. It's not just scientists. It's not just people who've been touched by disease, either themselves personally or members of their family. And it's a coming together of disparate groups that you normally wouldn't bring together. And I think for many of the scientific meetings that I go to, yes, the science is important, but, you know, there's other ways you can learn things, but there's a camaraderie, a coming together, the social bonding that I mentioned before that takes place at a gathering like this. There's a lovely mixture of you know, meals and cocktail hours and times together. But that said, there's always a range of science and developments. I often get to speak and I talk about my experience around the world. We have clinicians come to talk about their latest activities. We have people like Brad Black come from Libby, Montana, where they have the asbestos clinic there looking after the people of Libby and surrounding areas. who speak. We have a huge foreign contingent over the years. We have exhibits that are there. We have the last couple of years this astonishing array of products and pictures of products that contained asbestos in the past that one would never think of. So there's so much to this, and it's a chance to come together. And I think everybody that I speak to, and I certainly feel it every time, is, I mean, I do this day in and day out all year long, work in the area of asbestos one way or another. But what it also does is recharges my batteries about the issue. And I think everybody comes away from this meeting feeling that way. People have made connections that they haven't made before. They've met people. Because of this, I've had other invitations to do other kinds of work, to travel elsewhere. So there's so much about this meeting. And again, you know, those of you that know her, you know, this is redundant for you. For those that may not know, Linda, you know, pretty much at this point, single-handedly, she started this organization with others, but has kept this up for, you know, close to 2 decades now, and has not given up on this issue, has been a leader in putting people literally around the world together about this issue. It's a joy, a pleasure, and an honor for so many of us like myself and my fellow scientific colleagues to assist and lend our scientific knowledge and hopefully credibility to this. But this is an organization that has grown from, you know, Linda, you know, still trying to take care of a sick husband and dealing with this, to this internationally recognized leader organization in the world of protecting people from asbestos.
Yeah, but you all make it possible, and Simmons, Hanley, Conroy, and Motley Rice, and Whites and Luxembourg, and you guys allow us to do our work, and I am grateful to that. We're getting
also be mentioned is this is also done out of the heart of these organizations. Linda very correctly has had a very strict practice all these years. You know, the fact that a donation may come in does not mean anybody gets a recommendation, go use their services. This is all done without any quid pro quo. This is done out of the goodness of the heart of these organizations, and there's no expectation or understanding that they get anything back but the joy and pleasure of supporting this wonderful organization without any expectation of referrals or anything like that. That is not one of the things that the organization does. The only referrals it does do is lets people know where you can get good care and who are the good docs out there.
That's true. Thank you, Arthur. That was sweet. Makes me miss our conference even more. When I talked to Sarah, Erin, and Laura about doing these chats, the ladies were intrigued and thought it was a great idea. So we might every week or every 2 weeks throw in the mix. It won't be about COVID next time, but Arthur, you're always welcome to lead the charge. But we might kind of clean it up with, like, what is clean beauty looking like? Maybe we're talking about asbestos in schools, but make something informative but also non-threatening, and to build our circle of support, because I think we could all use a virtual hug. Sandy Kennard she says a statement. We only have a couple minutes and then we're going to close this. So Sandy, I'm going to ask that you're brief, you're unmuted.
Okay, can you hear me, Lisa?
Yes, uh-huh.
Okay, Linda, my daughter's Lisa. Always an honor to be you, the others worldwide when it comes to this issue of asbestos and mesothelioma. Before everybody leaves, I want to acknowledge the fact that what people are experiencing in the moment, as when you've been given a life-threatening illness diagnosis, you begin your anticipatory grief. That hit you like you're hitting a wall. And that's what people are doing now, not only because for the ones that grief is ramped up because of the COVID-19, but also all the other things that in this moment of self-isolation and social connections, things like that. So important to call it what it is so that you understand and jazz. I'm grieving. I'm not just saying I'm grieving. I'm seeing children, parents, my my partner's being sick, so many losses that we're experiencing in the moment that weighs heavy on us. So I just wanted to acknowledge that everybody has a lot of this right now, and it can become a really overload on them.
Thank you for bringing that together. And we can always link Sandy up by way of Facebook. So thank you, Sandy. So it's 12:30. I want to thank Courtney for being the moderator. Dr. Frank, I love you and I think you're amazing. And to our platinum sponsor, Sarah, and I don't know who else is on here. I don't know if Amy's still listening, Simmons, Hanley, Conroy. Thank you for believing in us for so long. And of course, to Ann and Ben and Motley Rice for allowing us to do our work. And we hope that the rest of you will follow us for the rest of Global Asbestos Awareness Week. We'll do a follow-up email, be a little patient for the updated page because Nicole and I are kind of together. We have about, 3.5 hands. So, but we'll get to that. So most importantly, thank you for joining us. And Dr. Frank, thank you for sharing your wisdom, your expertise, and that big, beautiful heart of yours.
Well, thank you. It was an honor to be asked to participate and share a few thoughts for a guy that's been around the block once or twice.
So cheers to all of you. Stay safe, wash your hands, and make sure your moral compass is pointed in the right direction. If not, Dr. Frank will get you on track. We're going to close the meeting. Thank you very much.
Bye, all.